Setting clinic. Your patient is 51 years old and has had a lesion removed from his hand following a diagnosis of squamous cell carcinoma. He was overexposed to the sun in his teens. You've come to remove the stitches. Hi, my name is Sakura. I'm the nurse at this clinic. How are you? Good, thank you. Now, before we get started, I'll just like to confirm your name and date of birth. Yeah, my name is Mark, born on 9th of April, 1970. Wonderful. Is it okay for me to address you as Mark? Yeah, that's fine. Okay. Now, I understand that you're here because you had a skin cancer lesion removed and now we need to remove your stitches. And is my understanding correct? Yes, it is. All right. And do you have any concerns? Yes. Well, the doctor said I had something called squamous cell carcinoma, which I think is just another name for skin cancer, but I'm a little worried. Of course. It's a big word as well. So you are correct. Squamous cell carcinoma is another name for a skin cancer. So it's a type of skin cancer caused by sun exposure. The surgery that you've had for it is very effective. So once you have the lesion removed, the cancer is unlikely to spread. And it's very important that you continue to monitor your skin and check for any new or changing spots and have regular doctor checkups as well. Any questions or concerns so far? Yeah, well, I have a better understanding of what squamous cell carcinoma is now. Am I likely to need more surgery to remove other lesions in the future? That's a great question. Now, I think that question is best answered by your doctor. So what I can do is I can organize for you to speak with the doctor. How does that sound? Yep, that sounds fine. All right. Now, I'd like to move on to finding out a little bit more about your habits when you're in the sun. So this is very, very important when it comes to preventing skin cancer. Do you usually wear a sunscreen when you're out? Yeah, I always wear a high-factor sunscreen, 30 or higher. Wonderful. And what about a hat? Do you usually wear a hat when you're out? Yes, I always wear a hat when I'm out in the sun. But I think it's just a bit too late because, the damage has already been done and I spent too much time in the sun in my teenage years. I can see where your concerns come from. However, it is really important that you continue to prevent, sun damage. It's very important. The reason why it's important is because sun damage causes skin cancer. Any questions so far? No, that's okay. All right. And I also want to ask, how's your wound been since the surgery? Is there any pain in the wound? No pain. Okay. And what about discharge? Is there any sort of liquid coming out from your wound that you've noticed? No discharge either. But I just think it's a bit too early to have the stitches out. I see. So you feel like it's a bit too early. Is there any reason why you feel that it's a bit too early? No, it just feels a bit too early. I see. Okay. Now, is it because you feel like the wound isn't healed yet? Yes. Okay, I see. Now, the stitches are typically removed after 7 to 14 days. And from our perspective, it looks like your wound is healing quite well. And the doctor also agrees that your wound is healing really, really well. And if it's okay with you, we think that it is best to remove the stitches now for optimal wound healing. Are you happy for me to remove your stitches? Yeah, that's fine. Okay. Now, before we move on to actually removing the stitches, I want to talk a little bit more about the aftercare. So once we remove the stitches, it's important that you keep the wound clean and covered and dry as well. Do you have any questions or concerns with your aftercare? No, that's fine. Okay, now I'll get the equipment ready to remove your stitches. And if you have any questions or concerns, please ask me anytime.